Is it possible to develop critical thinking in Roga Nidana learning? If yes, what is the simple step to have the critical thinking in Roga Nidana? This is the topic of discussion in this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you think about the critical thinking as such, so that is nothing but the methodical thinking, or what we can say, the thinking with a rationale to know about the unknown information. So that is considered to be critical thinking as such. So here is a 3-step formula to have the critical thinking, that is DCD formula. So which requires the thorough knowledge of the vocabulary used in the subject and what are the possible trends of the society that should be known whenever if you want to have the critical thinking in the subject of Roga Nidana. When you think about the DCD formula, it is being termed as decode, connect, discover. Decode, connect, discover. The term decode, which is otherwise also being termed as break, connect in the sense the link, and discover refers to apply. When you think about the term decode, so that means we need to know about the what are the vocabularies, how to decode those vocabularies in terms of the present understanding. So that is considered to be the method of decoding. So here one example was being given. So here the image is the plate of the gobi Manchurian, a bowl of gobi Manchurian. When you think about this, so this is considered to be responsible for the pitta dosha prakopa in the body, or vitiation of the pitta dosha in the body, as it is having the tejo mahabhuta dominance. Now, how to decode these aspects? Whenever if you think about this, regarding the percentage of rasa, first and foremost thing, in that particular dish. When you think about this, most of the occasions we are going to say there may be a possibility of katu, amla and lavana rasa substance. That is the percentage of that may be more. When you think about this in terms of the dosha, katu, amla and lavana rasa, so that may be responsible for the increase of the pitta dosha altogether. When you think about the amla and lavana rasa, there may be a possibility of the abnormal increase of kapha dosha also may take place in the body. And consumption of the katu rasa substance, there may be a possibility of increase of the vata dosha in the body. In the sense, depending upon the nature of the percentage of the rasa dominance, there may be a possibility of a pitta dosha increase as the main dosha, but there may be a possibility of increase of either vata dosha or kapha dosha increase that may be observed in the body. In this way, we can able to decode this particular information. Further, regarding the in decoding this, which particular guna is being increased in the body? We are knowing that pittam sasnehati shnushnam laghuvistram sarandravam. When you think about the consumption of this particular dish as such, which particular guna will be increased in the body? Is it lagu guna, or is it tikshna guna, ushna guna, visra guna, or drava guna, snigdha guna, etc.? That we have to analyze it. Then, when you think about the clinical presentation, which particular part of the body will be showing the pitta dosha increase in the body? Is it alimentary canal, or is it the skin, or is it some kind of the joint as such? So that is considered to be the identifying that particular aspect. For this, you need to have the thorough inquiry with the patient also. Regarding the percentage of each of these ingredient, we need to know what are the major ingredients. Sometimes it is considered to be the what you say the cauliflower or gobi that is being used. In some of the occasions, along with the gobi, even the cabbage will be used. What are the major ingredients? Along with that, we are going to use vinegar. Sometimes we are going to use the chili, red chili, green chili, etc. Sometimes we are going to use coriander leaves, the salt, etc. Regarding the percentage of each of these ingredients will be helpful. For example, the lavana rasa, the content, if it is 10%, the degree of pitta dosha vitiation may be different. If it is of 25%, again the degree of pitta dosha vitiation may be something different in that particular situation. In that way, so we have to know about this, the percentage of each of these ingredient. Again, we know that if the gobi is being used, that will be fried in the oil. How much the frying is being done? Either is it for 5 minutes, 10 minutes or 20 minutes? All those will be having the different, what you say, that the impact on the pitta dosha vitiation as such. Further, regarding the frequency of intake, how frequently a person is going to consume this particular, what you say, that the gobi Manchurian will be deciding the degree of dosha vitiation, pitta dosha vitiation in the body. And which are the other food substances they are being taken along with the gobi Manchurian? Is it chapati, or is it the kulcha, or is it the naan, etc. So that will be deciding the degree of pitta dosha vitiation in the body. Or is it associated with the butterscotch, etc., etc. So that will be considered to be the the responsible for the dosha vitiation that can be understood by these aspects, decoding these different informations. Now, how to connect these informations? So here we know that the person is having the this particular the Nidana Sevana, and the lady, she is having this particular clinical presentation. So that is burning sensation in the epigastric region. In the sense, so that is considered to be the clinical presentation wherein the Lakshana are being observed in the Mahasrotas. Maybe in the Prana Mahasrotas or maybe in the Anna Mahasrotas as such. So like that, we need to analyze these aspects and linking those information with the clinical presentation. We need to know what kind of the prakriti of an individual he is having, whether he is having the vata prakriti, pitta prakriti, or vata pitta prakriti, or vata kapha prakriti as such. So that will be having the different impact in the clinical presentation. Percentage of the rasa in the dish particular aspect. In this particular situation, this particular lady is going to consume more amount of the katu rasa than amla or lavana rasa. In that particular situation, there may be a possibility of the, what do you say, that vata association with the primary pitta dosha vitiation. Proportion of the guna. Depending upon the ingredient, there may be the possibility of the increase of ushna, tikshna, laghu guna in the body. And part of the body afflicted. Which particular part of the body is being afflicted? For this, you need to know regarding different terminologies. For example, Shadanga. These are the 6 parts of the body. Which particular part of the body that will be afflicted, that has to be known. So here, as such, this is considered to be the abdomen that is being afflicted. We are going to say it is the Antaradhi that is being afflicted. And as far as Roga Marga is concerned, this can be considered to be Abhyantara Roga Marga affliction. We may able to think about it. And the percentage of ingredient in the dish. Suppose if the person is having more amount of the gobi Manchurian, then the different way of the pitta dosha may be possible. If the person is having the gobi Manchurian along with the cabbage, etc., in equal proportion, then there may be a possibility of different type of the dosha vitiation may be possible. a pattern of food intake, how much frequency he is going to consume this particular food, gobi Manchurian. Suppose if he is going to consume in the afternoon to evening 3 or 4 times, again that will be responsible for the degree of the pitta dosha visheshana will be comparatively more than the individual who is going to consume the gobi Manchurian once a day. Other foods that are taken along with the food dish, that has to be considered in this particular occasion. Now, how to apply these different informations? So that is, for that we have to have the deep questions that has to be asked along with the client as such. So here there is an example that is being put forth. Suppose if the person is having the pitta prakriti, naturally, so the person is going to consume this particular substance, a little amount of the quantity may be responsible for the degree of pitta dosha visheshana will be comparatively much higher, much severe. And if the person is going to consume katu rasa in excess, amla and lavana rasa to a little lesser extent, then we are going to say there may be a possibility of pitta dosha vitiation to the maximum extent. Then there may be vata dosha vitiation to a lesser extent, even much lesser extent. There may be a possibility of a kapha dosha vitiation. And based on the guna, this particular the dish is having the green chili or red chili more, then in that particular situation, plus it is being fried with the oil, that means that is considered to be having the vidahi guna. So in the sense, ushna and tikshna guna will be much more. In that particular situation, which is again an indication that there may be a possibility of a pitta dosha vitiation. As far as the clinical presentation is concerned, so here as we have discussed earlier, udara is being afflicted, that is abdomen is being afflicted, and abhyantara roga marga involvement can be predicted. Percentage of the dish, if the gobi is 40%, labana is 10% is being considered, and amla is 5% is considered. So here the gobi will be fried with the oil, again which will be having the vidahi guna. In the sense, the degree of pitta dosha vitiation will be maximum in this particular situation. Suppose if the lady is consuming gobi Manchurian is being taken at around 9 p.m. every day continuously for 5 days, in the sense, though pitta prakriti individual going to consume this katu rasa, amla rasa and lavana rasa substances as such, having the green chili or red chili etc., plus fried gobi observed in the clinical presentation, observed in the alimentary canal as such, all they are indicative of the degree of pitta dosha vitiation is to the maximum extent. And if the lady is being consuming gobi Manchurian along with the butterscotch ice cream, we may suspect the totally different pitta dosha vitiation. Along with that, the kapha dosha vitiation may also be taking place. But the degree of pitta dosha vitiation will be maximum extent, whereas kapha dosha vitiation will be to a minimum extent. In this way, critical thinking requires a thorough understanding of the subject in terms of the vocabulary, whether it is dosha, dushya, srotas, agni, ama, rogamarga, sadhyata of the diseases, then the udbhavasthana, etc. Then the regarding different nidana, vyayama, atapa, ushna sevana, ruksha sevana, stigha guna ahara vihara, etc. So these are the different vocabularies one has to be thorough with. What are the current trends that are being followed in the society? Is it related to the more amount of the tikshna ahara sevana, or more amount of the laghu ahara sevana, or more amount of the lavana ahara sevana, etc., etc.? That trend has to be known. And based on that particular trend, we have to follow the formula of DCD: decode, connect, and discover. which is also being termed as break, link, and apply. That's all for today. Dear ANA community members, what are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in coming days in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. That's all for today. Something more in the next video. Thank you.